Okay, Cameron. Usually what we do in this sort of situation is just have a dry run. Is that okay with you?
Yes, that's fine.
It gets you a chance for you to get a feel of what the scenario is like, and also gets us a feel of how to calibrate the case. So I'm going to act as the candidate, and we'll just run it through for 10 minutes. Is that
That's
okay?
fine. Yeah, yeah.
So I'm going to start the clock now.
Okay.
So I'm Dr. Harvey. So I've been asked to see you this afternoon.
Yep.
It's Peter Morris, is that correct?
That's right, yes.
Yeah. So I gather that you've got high blood pressure, but your doctor says that your control's been quite poor recently, and he believes that you may not be taking your medication. Is that correct?
Yeah, that's right, absolutely.
Yeah. So you've had high blood pressure for about 2 years, I think.
Yes, yeah, I was diagnosed 2 years ago.
2 years ago, and you've been on medication since that time?
I have, yes, yeah.
Yeah, and have you ever taken your tablets on a regular basis, would you say?
Well, I mean, I used to take, when the GP first said I had high blood pressure a couple of years ago, I used to take medication, but it caused me problems, so I stopped, and then I was changed onto new medication, two new medications, and I was taking them, but I'm not taking them now.
Right. So are you not taking tablets at all?
No.
Okay, right.
No.
So, and I think you're meant to be taking ramipril and amlodipine, is that correct?
Yes, that's right.
Yeah.
But I don't see why I need to take these medications when I feel absolutely fine. So I don't really agree with it.
See, I haven't measured your blood pressure, but according to the records your GP sent, your blood pressure is quite significantly elevated when it's been measured. It's over 160 over 100. Now, the problem with blood pressure is that most of the time you can have high blood pressure and you'll feel absolutely fine. But it can store up significant problems for your health in the future. It particularly increases your long-term risk of heart disease, increases your risk of having stroke disease, and potentially also can harm your kidneys. And these are obviously potentially really serious things in the longer term.
I feel absolutely fine.
And that's the problem. It's, if you like, it's almost like a silent killer in the sense that people can feel fine, but actually underneath, inside, it's actually causing damage to your vital organs gradually over time, which is, we know from these type of drugs, if we can bring the blood pressure down to more normal levels, that will protect you from damage to your heart and stroke disease in the future. So, as an analogy, it's a little bit like smoking. We tell people not to smoke. It's well known it causes lung cancer. People would accept that.
I don't smoke.
And I know you don't. But people on a day-to-day basis say, "I feel fine. I have a cigarette. I feel fine." But at the same time, people do recognise that can cause a longer-term problem. So, high blood pressure is similar to that, in the sense that on a day-to-day basis, most people will have no symptoms from their blood pressure. It's when it catches up with you later, when it's actually potentially almost too late. We can do some salvage things, but prevention is far better than cures. It's far better to prevent you from having a heart attack than to deal with the heart attack when it happens.
I mean, is this medication I need to be on for the rest of my life?
Well, generally it would be, because high blood pressure is a condition that we can manage, but generally speaking, in most cases, we can't cure. And by cure, I mean doing something which will mean we can put in an intervention, the episode is over, and the problem has gone away. The medication is designed to bring your blood pressure down to safe levels, and it will work so long as you're taking it. But if you stop taking it, it tends to go back to where it was in the first place.
So, I mean, one of my concerns is, what are the long-term effects of taking this medication for the rest? So you say I need to be on this medication for the rest of my life. What's the long-term effects of? I mean, side effects and things. I'm not wanting all this. These side effects. I had side effects before when I took the medication.
What side effects did you have? What's worrying?
Well, I couldn't get an erection, could I?
Right, and that was with a different drug, was it?
Well, the first drug I was on, I can't remember the name of it. I couldn't get an erection. I mean, I've just got a new girlfriend. I'm not wanting things going awry in that department again.
Certainly, some drugs used for high blood pressure can cause that problem.
Well, exactly. So, I mean, so why would I take them if it's going to cause that problem? There's a new girlfriend. I mean,
some do. I don't know what drug you were on before, but certainly beta blockers can cause that problem. Some diuretic tablets, which are used for high blood pressure, can cause that problem. But by and large, it would be very unusual for these particular drugs, the ramipril and the amlodipine. They would not normally cause erectile problems in men. So I don't know whether you've noticed that difficulty when you've been taking these particular drugs, or whether you've noticed that it's less of a problem when you're not. But I wouldn't expect that to be a problem. And indeed, if it was on these drugs, and I said I wouldn't expect it to, obviously we could then try something different. So I think, rather than actually just have a blanket ban on all medication for high blood pressure because you're concerned of that, it would be more important to actually explore whether anything you are taking is causing that difficulty, and is then to move to another one. There are a number of different drugs we could use, but by and large, these would be the ones that are first-line drugs because they're effective, they have clean side effect profile, and in particular, they don't cause that particular issue normally.
So, I mean, are you telling me? I mean, these two drugs I'm on at the minute. Well, I'm not taking them. I mean, are you saying that they won't affect my sex life? Is that what you're? I
wouldn't expect them to. No,
because I'm not. Because if they're going to affect my sex life, I'm not going to take them.
We can never say never in medicine. So, I would not expect these drugs to cause problems with sex life in the vast majority of men.
I mean, I've not got time for all this. I'm busy at work. I haven't got the time to be taking these medications and things. It's just, even coming here today, it's really inconvenient for me to come in here today.
Yeah, I appreciate that, and I think it's really useful that you have, because it's given us an opportunity to have this discussion. What I would suggest, you asked me whether they could have long-term effects on your body. The answer is, broadly speaking, no. Any medication can have side effects. These are not without the side effects, but they're usually short-term in terms you would become aware of them normally in the short term when you take them. So Ribopene, for example, can sometimes cause a little bit of ankle swelling, which is usually not a significant problem in relatively young, otherwise fit people. Ramipril can cause problems if you became dehydrated, can sometimes have effect on your kidneys, but again, it's not likely to be a problem. Will they cause long-term harm by accumulating in your system? The answer is no. Their long-term effect is going to be beneficial. So, provided that you don't experience significant side effects with them early on, then we would normally be able to regard these as very safe and effective drugs that are likely to give you benefit, albeit that in a paradoxical way, you'll never know whether you've benefited, apart from the fact if you don't have a stroke and don't have a heart attack, then you can say, well, I haven't had a problem. You'll know if they haven't worked, if you have a problem, but you'll never know if you take them and you never had a problem, whether you would have been fine without them. Okay. But the evidence from the big trials and from population studies would strongly suggest this is a very effective medical intervention. So what I would maybe suggest is, and obviously this is up to you to decide.
Well, entirely, yeah. I mean,
but I would strongly encourage you to have another trial with this medication. You're not taking it at the moment, which in a way is good, because we've got a baseline of how you are on treatment.
Yeah.
If we were to introduce the drugs now and you took them for a couple of weeks or so, and then see whether you're having any obvious effects.
What do you mean? See what coming back in?
Well, you could either come back to the clinic, or we could have a telephone conversation. It doesn't necessarily have to have interruption.
I've not got time to be coming back and forward and having conversations with you about all this medication. Well, I'm busy. I've got a busy job. I work long hours. I haven't got time to be coming back and forward to the GP all the time talking about this medication.
So, well, maybe the more sensible thing then is, if you're willing to have a trial of them, and if they're fine, then you don't need to tell anybody, because you'll be happy with them. And if you have ongoing concerns, then you can come back and make contact. So if you're fine, you're fine. And to be honest, the conversation would just be you telling us, or you telling me that you're fine, and me saying that's fine, carry on. So we don't really need that conversation. But as a backstop, if actually you have any concerns with them, we need a way that you can get back in to either see me, your GP, have a telephone call, whatever is going to be most convenient for you. To be honest, I would suggest a phone call or an email would be the least disruptive if you want to make contact with us in the immediate term, rather than suggesting a consultation, because clearly time is quite of the essence.
Oh yeah, I haven't got time to be coming back in here again. I mean, I nearly cancelled this appointment today because I've just not got the time to be coming back and forward talking about something I don't really want to be taking.
So does that seem a reasonable plan?
I mean, yeah, I suppose so. I mean, I'm not best pleased about it, but if that's what you're saying to me, As long as it doesn't affect my sex life, I mean, I'm not having that problem again.
I don't think it will, but at the end of the day, you're going to be the one who can test that.
Well, yeah, tested it before and it was a problem.
Yeah, so I would strongly suggest that you try this medication
Yeah.
and actually test for yourself whether you think it's having any untoward side effects
Right.
for you. And then if you continue to take it, obviously we then need to check your blood pressure.
Fine.
And
Okay.
that's
Well.
time
Yeah.
up, I think.